This medication is a combination of ibuprofen and acetaminophen. It is used to relieve pain from various conditions such as headache, dental pain, menstrual cramps, muscle aches, or arthritis. Ibuprofen is a nonsteroidal anti-inflammatory drug, NSAID. This combination product works by blocking your body's production of certain natural substances that cause inflammation. This effect helps to decrease swelling, pain, or fever. If you are treating a chronic condition such as arthritis, ask your doctor about non-drug treatments and/or using other medications to treat your pain. Check the ingredients on the label even if you have used the product before. The manufacturer may have changed the ingredients. Also, products with similar names may contain different ingredients meant for different purposes. Taking the wrong product could harm you. Before taking this medication, make sure to read all the directions on the product package. If your doctor has prescribed this medication, be sure to read the medication guide provided by your pharmacist before starting to use it and each time you get a refill. If you have any questions, don't hesitate to ask your doctor or pharmacist. Take this medication by mouth as directed, with a full glass of water unless your doctor tells you otherwise. Also, make sure not to lie down for at least 10 minutes after taking this medication. If you experience stomach upset, try taking it with food, milk, or an antacid. The dosage of this medication is based on your medical condition and how you respond to the treatment. To reduce your risk of stomach bleeding and other side effects, it's important to use the lowest effective dose for the shortest possible time. Do not increase your dose or take it for more than 10 days unless directed by your doctor. For ongoing conditions like arthritis, continue taking it as directed by your doctor, and make sure to discuss the risks and benefits with your healthcare provider. If you're taking this medication, as needed, remember that it works best when used at the first signs of pain. Waiting until the pain has worsened may result in the medication not working as effectively. If your condition lasts or gets worse, or if you think you may have a serious medical problem, seek medical help right away. And if you're using this product to treat fever or pain, consult your doctor if the fever gets worse or lasts more than 3 days, or if the pain gets worse or lasts more than 10 days. Some common side effects of this medication include upset stomach, nausea, vomiting, headache, diarrhea, constipation, dizziness, or drowsiness. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. It's essential to monitor your blood pressure regularly while using this medication, as it may raise your blood pressure. If you experience any serious side effects such as easy bruising, hearing changes, difficulty swallowing, changes in mood or vision, or signs of kidney problems or heart failure, it's crucial to seek medical attention. In rare cases, this medication may cause serious liver disease. Seek medical help immediately if you experience symptoms such as persistent nausea or vomiting, loss of appetite, abdominal pain, yellowing of the eyes or skin, or dark urine. Additionally, if you notice any symptoms of a serious allergic reaction, such as fever, rash, swelling, severe dizziness, or trouble breathing, it's important to seek medical help promptly. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, it's best to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Non-steroidal anti-inflammatory drugs, like ibuprofen, may rarely increase the risk for a heart attack or stroke, especially if taken for a long time. This risk may be greater in older adults or if you have heart disease. Also, taking too much acetaminophen may cause serious liver disease. Adults should not take more than 4,000 milligrams, 4 grams, of acetaminophen a day, and people with liver problems and children should take less. It's important to ask your doctor or pharmacist how much acetaminophen is safe to take and to avoid using it with any other drugs containing acetaminophen. If you take too much acetaminophen, seek medical help right away, even if you feel well. Also, daily alcohol use, especially with acetaminophen, may damage your liver, so it's best to avoid alcohol. This drug may rarely cause serious bleeding from the stomach or intestines, and older adults may be at higher risk for this effect. If you notice stomach/abdominal pain that doesn't go away, black/tarry stools, or vomit that looks like coffee grounds, seek medical help immediately. It's important to talk to your doctor or pharmacist about the benefits and risks of taking this drug. Before taking this medication, it's important to talk to your doctor or pharmacist about any allergies you may have to ibuprofen, acetaminophen, aspirin, or other NSAIDs. This medication may also contain inactive ingredients that could cause allergic reactions or other issues, so be sure to discuss this with your pharmacist. It's also important to inform your doctor or pharmacist about your medical history, especially if you have asthma, blood disorders, heart disease, high blood pressure, liver disease, or stomach/intestinal/esophagus problems. Additionally, kidney problems can sometimes occur with the use of NSAID medications, especially if you are dehydrated, have heart failure or kidney disease, are an older adult, or take certain medications. Be sure to stay hydrated and notify your doctor if you experience any changes in the amount of urine. This medication may cause dizziness or drowsiness, and using alcohol or marijuana can intensify these effects. It's important to avoid driving or using machinery until you can do so safely, and to limit alcoholic beverages. This medication may also increase sensitivity to the sun, so it's important to limit sun exposure and use sunscreen and protective clothing when outdoors. Before undergoing any surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be at greater risk for stomach/intestinal bleeding, kidney problems, heart attacks, and strokes while using this drug. For women of childbearing age, it's important to discuss the benefits and risks of using this medication with your doctor. If you are pregnant or plan to become pregnant, it's important to inform your doctor, as this medication could harm an unborn baby and cause complications during labor and delivery. It is not recommended for use in pregnancy from 20 weeks until delivery, and if your doctor determines that you need to use this medication between 20 and 30 weeks of pregnancy, it should be at the lowest effective dose for the shortest possible time. Additionally, this medication passes into breast milk, so be sure to consult your doctor before breastfeeding. When taking this medication, it's important to be aware of potential drug interactions, as they may change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Additionally, some products that may interact with this drug include aliskiren, ACE inhibitors, corticosteroids, and water pills. It's also important to note that this medication may increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. It's important to check all prescription and non-prescription medicine labels carefully since many medications contain pain relievers and fever reducers. If you are directed to take low-dose aspirin for heart attack or stroke prevention, it's important to continue taking it unless your doctor instructs you otherwise. This medication may also interfere with certain lab tests, so it's important to make sure lab personnel and all your doctors know you are using this drug. Make sure to discuss with your doctor about the best timing and dosage for your specific condition. If you or someone else has taken too much dual-action pain reliever and are experiencing severe symptoms like passing out or having difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe stomach pain, trouble breathing, and extreme drowsiness. It's important to keep all your regular medical and lab appointments. This will help ensure that you are getting the most benefit from the medication and allow your healthcare provider to monitor your progress and make any necessary adjustments. If you are taking this medication regularly and you miss a dose, take it as soon as you remember. If it is near the time of your next dose, skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. It's important to store this medication at room temperature, away from light and moisture, and not in the bathroom. Keep it out of reach of children and pets. When you no longer need it or it is expired, make sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.